Coronavirus has reshaped every part of American life. In an effort to keep people safe, the CDC has issued guidelines encouraging people to wash their hands, clean surfaces, wear masks in public, and distance themselves from others when going out. Imagine if you didn't have the ability to abide by these guidelines. Some of the most vulnerable people in America face that reality. Everyone should have the right to keep themselves healthy. Everyone should have the right to protect their lives. This is why Anna and I stand resolved. The United States federal government should take an extreme new action in the fight against COVID-19. Federal prisoners who are not threats to public safety deserve to be in safer circumstances. In order to understand some key issues, we'll need to look at a couple of definitions. Definition 1, extreme. Extreme is defined by Merriam-Webster in 2020 as, quote, exceeding the ordinary, usual, or expected, end quote. Definition 2, probation. This is defined by the Legal Dictionary in 2020 as, quote, a sentence whereby a convict is released from confinement but is still under court supervision, end quote. With these definitions in mind, let's move on to our fact. Fact. Thousands of nonviolent federal prisoners. Thousands of nonviolent federal prisoners. According to a chart from the Federal Bureau of Prisoners, updated April 18, 2020, and a definition of violent crime by the Bureau of Justice Statistics, accessed April 22, 2020, there are currently 102,736 nonviolent prisoners in the federal prison system. These are over 100,000 people that the federal government has the duty to protect in times of unexpected crisis, like right now. But in order to understand the conditions these prisoners are living in, let's look first at our harm. Harm 1, extremely contagious. Extremely contagious. According to a study by the Center for Disease Control and Prevention on April 7th, 2020, quote, when infected persons are isolated after 5 days of symptoms, we estimate the median of the estimated R0 is 5.7, end quote. This means that about 6 people will catch the disease from every 1 person with COVID-19. That means it's at least 4 times more contagious than the flu. Let's put that in the perspective of prisons. Prisoners live together in extremely close proximity and often have a shortage of cleaning and hygiene supplies. This leads me to harm 2. Harm 2, breeding grounds for infection. Breeding grounds for infection. This comes from Ned Parkner, Linda So, Brad Heath, and Grant Smith, reporting for Reuters on March 28, 2020. And it says, quote, the coronavirus outbreak is now sweeping through New York's Rikers Island jail system. Inmates have no access to gloves or proper masks and have only cold water to wash their hands. There is no protection. The article goes on to say, federal prison guards have asked for permission to wear masks on duty, but the Bureau of Prisons has so far declined, end quote. But supplies and social distancing are only half the battle. Global pandemic or not, prisons are usually breeding grounds for infectious diseases because so many prisoners have underlying conditions. The Philadelphia Tribune warned on March 25th of 2017, quote, researchers estimate about 40% of incarcerated people have at least one chronic health condition, such as diabetes or hypertension. Inmates have high rates of chronic medical conditions. Prisoners may develop health problems while in prison, thanks to unhealthy and unhygienic prison conditions and poor control of infectious disease. Prisons can be a breeding ground for infectious diseases, end quote. Coronavirus will spread like wildfire if we don't take extreme action. An extreme, unprecedented crisis warrants extreme, unprecedented action. This leads me to the plan. Mandate. The U.S. Federal Bureau of Prisons will place all nonviolent offenders on probation. Offenders who are already known to have COVID-19 will remain in prison. Once a state where a federal prison is located officially declares itself on phase 3 of reopening, all nonviolent federal prisoners in that state will return to prison. Prisoners will be eligible for food stamps equal to the cost of their food in prison while on temporary probation. Funds will come from the food budgets of the affected prisons. Timeline. Effective immediately. Agency and enforcement, the Federal Bureau of Prisons, and the federal criminal justice system. While we would be directly preserving the health of prisoners and staff members, we would also be indirectly preserving the health of the staff members' families and their communities. This leads me to the following advantage. Advantage. Virus contained. Virus contained. This comes from Daniel A. Gross on March 25th, 2020. Quote, it's nearly impossible to provide infection control in these settings. Greg Gonzalez, an epidemiology professor at Yale School of Public Health, told me. You wanted to set up a situation that would promote the rapid transmission of a respiratory virus, you would say prison. It's close quarters, unsanitary, and individuals are in frequent contact. End quote. This leads me to the impact. Impact, community protected. Community protected. This virus in the prison system would be the perfect storm. Prisons are overcrowded and unsanitary, and the perfect breeding grounds for disease. If we don't do something, coronavirus will sweep through prisons like wildfire. And when it does, it will impact more than those inside its walls. Because the employees are going in and out, exposing their families, whole communities could be infected. Everyone should have the right to keep themselves healthy. Everyone should have the right to protect their life. If we don't act soon, thousands of vulnerable people will face life or death circumstances. But with our plan, we would not only preserve the health of the prisoners, but also staff members and their communities. Thank you, and I now stand open for cross-examination.
Okay. Since you're ready, I'll go ahead and begin. Could you send us a copy of your case?
Yes, my partner will do that.
Okay. How many prisoners are at risk of infection?
So, all of them. Almost all of the prisoners in the prison are at risk of getting infected because it easily sweeps through. So, because of the way the conditions are, any of them could get it.
Okay, how do you define a non-violent offender?
So it's very hard to find a specific definition since the government doesn't define nonviolent, it only defines violent. So in our 1AC, you can see basically what crimes qualify.
Okay, and which crimes are these?
They are crimes like immigration crimes, embezzlement, and drug crimes that are not related to violence, of course.
Okay, and we can agree that these people are in prison because they committed a crime, right?
Yes, of course.
And why do people go to prison when they commit crimes?
Some of them go to prison in order to keep people safe, and it's also it's supposed to be a deterrent of crime. You don't want people to think that it's a good thing, so you give them a punishment.
Okay, so we put people in prison so that they won't commit any more crimes.
Yes.
Okay. If someone's on parole, are they allowed to go out at all?
Yes, they would be allowed to go out so long as the officer that was in charge of supervising them would allow that.
Okay. How many prisoners are we letting out?
So we would be letting out, we gave the number of nonviolent federal prisoners. It was a little over 100,000. And we don't know how many of those are showing symptoms. So if they had symptoms, they wouldn't be released, but probably most of them would be released.
Okay, do you think it's safe to assume that not all of these prisoners would get infected if they stayed in prison?
Well, there might be a few that didn't get infected, but with the way that it sweeps through jails, it's very unlikely that a large number would remain uninfected.
Okay, so the amount that you're saving would be less than 100,000, right?
I don't know how many people's lives this would save specifically. It's impossible to tell that.
Okay, but if you're letting 100,000 out and some of those people wouldn't have died otherwise, then it will be less than 100,000.
Again, I don't know. And in addition to also protecting the people we're sending out, we're giving the people inside more resources and more room to social distance, so it'll also improve their conditions.
Okay.
Starting prep time. Stopping prep time at 1 minute remaining. As long as no one's not ready, let's get started. What the affirmative team has done today is they've provided a plan. And that plan is to take an extreme action against COVID-19. Now, we're not going to be arguing topicalities, so yes, their plan does follow under the resolution. However, what we are going to be arguing today is that the affirmative team does not actually help the situation, they actually make it worse. Not only because they haven't really proven a significant harm, but also because what their plan will be doing is they're going to be harming people outside of these prisons. And let's keep one fact in mind throughout this debate as we go on. These people are in prison for a reason. So first, we're going to be getting into a significance point of no proven death. That's no proven death. Now, throughout the affirmative team, entire 1AC, they haven't really proven why these infections are necessarily detrimental prisoners. Now, I do agree that all human life is valuable and that we should be protecting these prisoners as much as possible. However, what they haven't shown, why taking them out of this situation is going to help them at all. Sure, yeah, they'll get sick if they stay in, but they haven't really shown why getting sick is a bad thing. They haven't proven any sort of deaths that may occur, how many lives we may be saving, because we simply haven't been shown the numbers at all. And before we can pass a policy, we need to know the quantifiable, tangible benefits of passing their plan. Simply saying that, oh, it'll probably help a bunch of people is not good enough. We need to know the benefits so we can weigh the benefits against the costs. So what we have right now is some shaky benefits that may or may not be there. And when we weigh them against the huge disadvantages, we'll see later that it's simply not worth it to pass their plan. So the impact under significance of no proven death is outweighed. And here in a little bit, we're going to be seeing how their entire plan is outweighed by the disadvantages that come. But first, let's get into a solvency point of not enough housing. That's not enough housing. Now, the affirmative team at no point in their plan has really shown that we actually have the capacity to take these prisoners in at all. So that leads to two options. First, these prisoners either go out on the streets and go around infecting more people, not staying in their homes, or second, us piling the prisoners together in a bunch of homes near each other, thereby not actually helping the problem and in a way increasing the risk, because now we're putting them in an even smaller space in a small house together. You see, this actually isn't helping the problem. The impact under here is increased spread. You can write this down as increased spread. Now we're going to be getting into this in disadvantage 1, accelerated spread. Now, when we release all these prisoners that the affirmative team says need to get out of there because they're in danger of being sick, well, the probability that quite a number of them are sick and simply don't know it is rather high. You see, the way coronavirus works is, or COVID-19 specifically works, is you don't know that you're sick. Even if you can pass the sickness on to someone else, you don't know that you can until 2 weeks later, 2 weeks after you actually got the virus. You see, this is a very shady virus because it's hard to tell who has it and who doesn't. You need very sophisticated tests that a lot of these prisons don't have. So subpoint A under here is unknowns. There is an overwhelming number of unknowns with who is sick and who isn't in these prisons. So trying to decide who gets to go out based on who we think is sick is really dangerous because we don't know who has COVID-19, who has a simple cold, or who doesn't have it at all, or who has it and isn't showing symptoms. You see, it's extremely hard to determine who has it and who doesn't. Therefore, before we actually pass the affirmative team's plan, we would need some sort of way to tell who is sick and who isn't. But these prisons simply don't have the tests because those tests are going towards different cities and hospitals instead of to these prisoners. So subpoint B under here is social distancing. Social distancing is an extremely important part of slowing the spread of this virus because it makes sure that our hospitals are equipped to deal with whoever comes in. However, by allowing these prisoners to go out and infect everybody else, prisoners that we may or may not know are infected, well, that's extremely dangerous, especially when a lot of these prisoners are going to be allowed to go, a lot of them are going to be allowed to go anywhere they want. As stated in cross-examination, these prisoners are going to be allowed to travel quite freely. So subpoint C under here is lawbreakers. These prisoners are the lawbreakers. They're not the ones who are going to abide to the strict social distancing rules. They're the ones who have willingly disobeyed the law before, and to think that they'll do it now is absurd. Impact 1 under here is increased spread. You may have seen this coming. We're increasing the spread by allowing these prisoners to go out. But impact 2 is prolonging quarantine. We're prolonging the quarantine for everyone else whenever we let these prisoners go out, because that means that everyone else has to stay in longer because there are more cases going around, because there's a lot more people being irresponsible, and therefore we're harming the economy. So disadvantage 2 here is increased crime. You can write this down as increased crime. Remember, these prisoners are in prison for a reason. They're locked up for a reason, which is subpoint A, prisoners for a reason. These prisoners are not in prison because they only committed small crimes that nobody really cares about, not because they jaywalked. They're in prison because they've done something that deserves to have the, or that they did something so that they would be locked up. So subpoint B under here is increased crime rate. When we decide to allow these prisoners to go out, we're increasing the crime rate because there's already been a lot of courts that have decided that these prisoners need to be put in prison in order to avoid harming the general public. But when we take them out of prison, that's obviously going to be harming the general public because these prisoners were needed to be in prison in order to avoid any potential harm. Or actually, impact 1 under here is robbery increases. Just because it's not a non-violent, or just because it's a non-violent crime does not mean that nobody will be harmed. In fact, the only crimes that are really listed, I believe, were things such as murder, rape, and sexual assault. However, these kinds of things are, well, they are bad, and I don't think these people should be let out. There's tons of other crimes that people can be harmed by. There's things like robbery, or there's things other than simply these violent ones. So impact 2 under here is livelihoods destroyed. We're destroying the livelihoods. While we may not necessarily be taking life from some people, by increasing crime, we're destroying a lot of livelihoods. So impact for both of these disadvantages, one big impact, is punishing the rule followers. At the expense of the people who have followed the law, who have avoided prison, we're allowing these prisoners, the people who've broken the law, to go free. This is bad because we're essentially punishing the people who followed the law and giving the people who've broken the law a break. Remember, these people are in prison because they've chosen to break the law. And well, I agree that we should be trying to help them as much as possible. I don't think we should do it at the expense of the rule followers. Thanks.
Assuming everyone's ready, I have my timer set for 3 minutes, and I'm going to begin. Okay, that was a great speech. I just have a couple of questions for you. So first of all, do you think that everyone should have the right to protect their own life?
Yes.
Okay, great. So do you know specifically how many people in the world are going to die because of COVID-19?
I do not.
Does anybody?
No.
Should we do anything about it if we don't know specific numbers?
I believe we should, but I think we also need to know general ballpark numbers.
Thank you. Is probation the same thing as freedom?
No.
Okay. So do probation officers still enforce the law and watch over their charges?
When probation officers are available and there's a small enough group of people that the probation officers can control, then sometimes they can.
Okay. And are you aware that normally the parole officer or the probation officer will ensure the person has housing?
I'm sorry, could you repeat the question? You were a little fuzzy there.
Sorry. So the probation officer, would you agree that the probation officer makes sure the person isn't living on the streets?
No.
Okay. Why do people social distance?
To avoid infecting each other.
Okay. Is that effective?
Sometimes.
Okay. Would a prisoner have any incentive to social distance?
I'm sorry, could you say that again?
If someone is a prisoner who has been released, would they have any incentive to social distance? Like, would they want to because it would protect their life?
Yeah, I think so, yes. If it really would.
Okay. Thank you. No further questions.
No affirmative prep time will be needed. I'll set my timer for 8 minutes, and assuming everyone's ready, I'll begin. Whenever we look at a policy, we need to look at its purpose. So today, that's what I'll be doing, explaining how Bela and I believe that everyone has a right to protect their own life, especially in such a crisis like we're in right now. So today, I'd like to look at some of the concerns brought up in the last speech, explain why they're unfounded, and then clarify the affirmative position. I'd like to begin with my opponent's first argument. He talked about no proven death, and I have one main response with one subpoint. You can write this down as impending death. Impending death. He said that since people, or a large majority of people, hadn't died already, we basically shouldn't do anything. But that not only defies logic, but it defies the facts that we brought up in our 1AC and that what I will bring up in just a minute. And this leads me to my first subpoint, restraining order. Restraining order. Now this one takes a bit of explanation. The ACLU, or the American Civil Liberties Union, actually looked at the conditions in one federal prison, Oakdale Federal Prison in Louisiana. And what they found was appalling. In fact, the ACLU actually issued a restraining order telling the Federal Bureau of Prisons that the situations in that prison was so dire that they must do something about it. As ABC News reports on April 13th of 2020, quote, the American Civil Liberties Union seeking a temporary restraining order against the Federal Bureau of Prisons plan at Oakdale Prison. The documents contend that BOP is moving too slow to avoid a human catastrophe at the facility that houses more than 1,800 inmates, end quote. So contrary to the negative belief, there is a huge problem here, a problem big enough for a civil liberties union to issue a restraining order. And so there is no problem with significance with our plan. Next, I'd like to address my opponent's solvency concern. He was concerned about housing, and I have a couple of responses. The first one you could write down as probation protocol. Probation protocol. When someone is issued on probation, when they're let out to be supervised by a probation officer, they aren't provided with housing, and normally they aren't even provided with food stamps. But Bela and I are giving them a leg up. We're helping them with food stamps, but we're sticking with the normal probation protocol of not giving them housing. Normally, people on probation end up finding some place to live, whether that be with relatives, where they can social distance, or somewhere else. And this leads me to my second response. Better than prison. Better than prison. We need to give these prisoners a chance to social distance and not keep them in a surefire way to get coronavirus, which is prison. And this leads me to my third response. Temporary. Temporary. We need to realize that this is a temporary solution and that these people will eventually go back to prison. This isn't a long-term solution, and Bela and I understand that. Next, I'd like to address my opponent's first disadvantage and his first subpoint, with one main response of decreased spread. Decreased spread. Now, because I am a debater, I have plenty of subpoints under this. The first one you can write down as subpoint A. Social distancing on probation. Social distancing on probation. See, there's a logical incentive here. We need to give these prisoners let out on probation the opportunity to social distance, the opportunity to abide not only by their local restrictions that would mandate social distancing, but also they give them the chance to preserve their own life by not getting coronavirus. And this leads me to my second subpoint. Logical incentive. Logical incentive. No one wants to get coronavirus and die. That's why most people are incentivized to take restrictions, to take precautions to protect themselves. This leads me to subpoint C, local enforcement. Local enforcement. See, local authorities in the area where these prisoners will be released on probation will be enforcing local social distancing restrictions. Now I'd like to address my opponent's argument of unknowns, specifically with my subpoint D, non-unique. Non-unique. Bela asked him in cross-examination whether, because we don't know something, whether we should do anything about it. And he said, of course we need to do something about it if we're in a dangerous situation. That's the same logic that applies here. Sure, there are a lot of unknowns, but we're in an unknown situation. Next, I'd like to address his concern of prolonging quarantine with the response of unproven assumptions. Unproven assumptions. Bela and I have laid out with evidence in our 1AC the logic behind our case, while the negative team has not brought up any such evidence. Finally, I'd like to address a couple of my opponent's last points. He said he was concerned about the safety, and he cited specifically that people were in prison for a reason. And I agree, but I have one main response. Precedents of nonviolence. Precedents of nonviolence. We have to understand that the majority of people in federal prisons are actually in there on immigration charges or drug possession. These aren't people who have a violent history, and that's why we're allowing them to go on probation. I'd like to address his subpoint B, increased crime, though, with one specific response. Proven to decrease crime. Proven to decrease crime. According to Bart Crater, on May 23rd of 2012, quote, a probation officer monitors the probationer's progress through frequent interaction. The probation officer has opportunities to identify issues such as mental health and substance addictions. Many times it is these other areas which underlie the criminal behavior. When such issues are identified, the court can order requirements that reduce the recidivism of probationers. Probationers are more likely to pay their fines, fees, costs, restitution, and less likely to reoffend, according to the Texas Criminal Justice Coalition, end quote. This whole idea that probation is not safe simply doesn't stand up to critiques by studies such as the one I just brought up. The evidence doesn't prove what the negative conclusion that the negative team has drawn. Finally, I'd like to address my opponent's last two arguments of increased robbery and decreased livelihoods, and with one main response. You can write this down as unproven extrapolation. Unproven extrapolation. Again, we haven't seen any evidence from the negative that this will actually take place, while Bela and I have provided evidence that there is a problem and we need to solve it. Logically, our solution will make a difference. And this leads me to one point of my own. You can write this down as lives outweigh. Lives outweigh. Like I said at the beginning, everyone has a right to protect their own life. And we shouldn't leave people caught in the petri dish of a prison. We need to give them the chance with the logical incentive to social distance to protect their own life. So for that reason, I would urge an affirmative ballot.
All right. What crimes are considered nonviolent?
I can find that evidence in the 1AC and read the specific crimes if you would like.
Okay, but do you know any off the top of your head?
Yes, drug possession, I believe bribery, several financial crimes that I can't name off the top of my head, and immigration.
Okay. So we're letting people who've illegally possessed drugs out of these prisons, right?
For a temporary probation term, yes.
Okay. How many prisoners have died because of COVID-19?
We don't have a specific number on that, but
Okay.
like we saw with the evidence at Oakdale Prison, there's a significant risk here.
All right, but just to be clear, we don't know of a single person dying in a prison because of COVID-19.
Well, I never said a single person. I'm sure plenty of people had already died at prisons. It's just a matter of those deaths being reported and looking at the risk.
Yeah, so how do we know that people have died in prisons?
Because the prison would report those statistics to a higher federal.
Okay, so do you have any of those reports?
Not on hand.
Can you bring them up? Do they exist?
I don't have them on hand right now.
All right. So just to be clear, we don't know, or we can't read evidence on any of the deaths that have occurred because of this virus in prisons, right?
Well, Bayla and I have brought up 3 pieces of evidence now stating the significant risk. And while we can't say a specific death number, we know from health experts there's a huge risk.
All right, but we're not aware of any deaths.
They haven't been reported in a specific statistic report.
Gotcha. So will all of these 100,000 people that you're releasing, I believe that's the number, will all these people get a place to stay, like a home?
No, that's not a normal probation.
Right, so where are they going to stay? Will they stay on the streets? Will they stay in hotels?
I don't believe many of them will have money to stay in hotels,
Right.
but some of them could stay with relatives who perhaps have a room in their house that they could share to help them social distance.
Okay, so just to be clear, we're taking these people who may or may not be infected out of prisons and putting them in other homes with other people, right?
Well, part of the probation officer's job is not only to make sure they have housing, but also to make sure that people are abiding by the local restrictions. And the local restrictions would involve social distancing.
Understood. Thank you.
All right. This is going to be your second negative constructive from Levi Magness. And I'm just going to assume everybody's ready and get started. I'm going to be talking about their case, and I have a lot to get to, so let's jump right in. The first argument they really talked about past their fact was harm 1, extreme contagion. I don't have contention with this. I do agree that COVID-19 is contagious, but I don't think that that the affirmative team is taking adequate action to prevent the contagion of COVID-19. As we'll see in my response to harm 2, which was breeding grounds for infection, you can write down my response as anecdote. Now, what the affirmative team has shown you was one example of a prison in New York, which, might I remind you, is the hardest hit state in the United States of America. They've brought out one prison from a hotspot for COVID-19 that has coronavirus. Well, of course it has coronavirus. It's in New York, and New York is the most highly infected place in the United States. It's no surprise that maybe a prison or other communities have the virus there. What the affirmative team has not shown you is that this is a problem, that this is a widespread problem that requires federal government action. You see, Congress can't make decisions and can't act based on one prison in one state. They can't do that, because if they did, we would have an even more inefficient system than we already do. Congress, in fact, that's why the United States has sub-governments and state governments to deal with these types of things. You see, just by the affirmative team has given you an anecdote of one problem that happened once. They haven't proven to you that this is a widespread problem, so there's no reason for us to believe that this requires government action. Let's talk about their plan, which they said we should release all nonviolent offenders. My response is non-unique. Now, under this, they read a piece of evidence, which, might I remind you, was from 3 years ago, before coronavirus ever existed. They talked about how prisons were particularly contagious to diseases like HIV and AIDS and tuberculosis. Now, this doesn't mean that we should let all prisoners go. This harm that they talked about was specifically talking about other diseases. They're saying that we should let people go because of this harm. That doesn't make a lot of sense because those diseases existed before COVID-19 did. So if the affirmative team believes that based on this evidence, based on this harm, that we require to let prisoners go, they would have thought that we should let these prisoners go 3 years ago when this evidence was written, when this evidence said that this was a breeding ground for infection. All I'm saying here is that prisons have been ill-kept for years. They haven't proven that there's anything unique to coronavirus that means we have to let people go. This evidence was specifically talking about 3 years ago, which means that under the affirmative team's logic, it would be justified for us to just let all nonviolent prisoners go because they're always ill-kept. This obviously doesn't make any sense, and this obviously isn't a reason to vote for their case. Let's talk about their advantage, which was virus contained with an impact of community protected. Now, I have 2 solvency points I want to talk about, and these are just going to show you how these how their case doesn't actually solve any harm, and in the end, we're going to see how it actually causes more harm. Solvency 1, you can write down as no way to know infection. Let me introduce you to 2 experts. One is Sheldon Campbell, and the other is Randy Epstein. Sheldon is a PhD and an MD, a professor of laboratory medicine at Yale, and an associate chief for the clinical laboratories for the Virginia-Connecticut healthcare system. Randy Epstein is an MD and the writer of Residence of Yale School of Medicine. So essentially, they know what they're talking about when they say this on April 22nd, 2020. Quote, making matters more complicated, many countries, including the UK and the US, have had new problems getting enough supplies for testing. It's not so much a matter of lacking the raw materials, but making sure that they're pure and that they're mixed in the right amounts. End quote. So what does this mean? This means that there's no possible way for us to know how many people have the disease and who these people are. What does this mean for the round? Well, the affirmative team says, well, we're not going to let people out of prison who have the disease. But here's the thing, we have no idea who these people are. As we've seen, there's no way to figure out. So just letting people, so the prisons are left with one option, which is to make quote unquote educated guesses on who's infected and who's not, which is obviously extremely dangerous. And it's not going to help the spread of the infection because we're just letting these people who are very quite possibly infected out into community. My next solvency point you can write down as housing. Caleb touched on this a little, but I want to talk about how this applies specifically to their 1AC. In their 1AC, under Fact 1, they talked about nonviolent offenders. So subpoint A is 50% of all prisoners. They considered in their case that drug offenders were nonviolent offenders. The fact of the matter is that in their own 1AC, drug offenders make up for about 45% of the inmates, according to their own evidence. And if we take that 45% and add it to the other nonviolent offenders, like she talks about financial or cyber crimes, that makes about, or even more than 50% of all prisoners. And you know what the affirmative team is saying we do with those 50% of the prisoners? They're saying we let them all go. Subpoint B is no possible way. There's not a single way on earth that we have enough room, enough capacity in the US to safely hold 50% of all our prisoners outside of prison. That just doesn't make any sense. The affirmative team has done nothing to show you how this is possible, and that's something they have to lay out before we pass their case. So now that we have that out of the way, I'm going to show you through one disadvantage how these solvency actually turn into bad effects by voting affirmative. You can write this down as dangerous to the public. Here's what the affirmative team is doing. They're taking these prisoners that obviously went to prison for doing something bad, and they're saying these people are likely infected. Let's put them back into society. That doesn't make any sense. We're putting them back into society where we cannot guarantee that they're going to social distance because, again, they're lawbreakers. As they stated, we'd be putting some of these people in homes with their relatives, obviously putting their relatives at risk. We already saw how we have no idea if these people are infected or not. And we already saw how the affirmative team hasn't proven a unique harm. So this is a dangerous policy for the public, because not only are we putting 50% of all prisoners back into the economy, which, might I remind you, that's 45% of all the prisoners who are all drug offenders. One very bad drug offense, or one very bad prison offense. We're putting them all back into the public. This is obviously dangerous, and obviously something that would be irresponsible for Congress to do, and it's obviously something that we shouldn't be doing right now. Thanks.
All right, setting my timer for 3 minutes, and assuming everyone's ready, I'll begin. Hi, Levi. I just have a couple of questions about your speech. So can we agree that coronavirus is an infectious disease?
Yes.
All right. And can we agree that the evidence we read under Harm 2 was specifying infectious diseases, correct?
Excuse me, what evidence are you referencing?
The evidence under Harm 2, breeding grounds for infection.
Yes, the evidence was talking about other diseases.
But you would agree they specified infectious disease.
Yeah, they equate the coronavirus to things like HIV or tuberculosis.
Okay, so we can agree that since the evidence lays out that most prisoners have an underlying condition, they are more susceptible to infectious disease.
Yeah, that's exactly what it says.
All right, now as to your solvency point, can we agree that since this is a new crisis, we don't have specific numbers on how many people have already died or tested positive in?
Sorry, you cut out. Could you re-ask the question?
Sure. So can we agree that since this is a new crisis, we don't have numbers on specifically how many prisoners?
How many prisoners? Sorry, you cut out another time.
Sure. So basically, since this is a new crisis, can we agree that it would take a while for the prisoners, or the prisons rather, to submit statistics to the government to report cases of coronavirus?
I would guess so.
All right. Thank you. No further questions.
All right. With 5 minutes, let's get started. Now, I want to make one thing clear, and that's we don't need a specific number on how many people have died. We don't need a super specific number down to the person of how many people have died. What we do need, however, is to know that somebody has died. We need to know that we need to know a ballpark range of who has died and how many people actually have died. The reason why we need to know this is because we need to know if people are dying at all to begin with. But the funny thing is, when I asked in cross-examination, do we know or do we have evidence or do we have one case of somebody dying from COVID-19 in a prison? The problem was she couldn't bring up one. And the reason why that's a problem is because if we don't know that people are dying from COVID-19 in prisons, then there's really no link to an advantage of their case. Their whole case is that we're saving lives. We're saving people that would have died in these prisons, but if they can't prove that people would have died in these prisons, then we don't really have an advantage of their case. Now let's go into some direct responses. They talked about impending death. My response here is no link. Now, once again, I'm not saying that they need a super specific number, but given that they can't even bring up one single example of someone who has died because of COVID-19 in a prison, well, it just goes to show how insignificant this problem could be. The problem is that we don't know. Now, at the beginning of this round, you said that you liked facts and you liked us to bring up evidence and specific reasoning for our facts that we talk about. But because the affirmative team has not really proven or brought up any facts for if anybody's died because of this in prisons, we can't vote for them. They talked about probation protocol, better than prison, and temporary. In response to all three of these arguments, that was in response to the solvency argument, I have one response, and that's increasing spread. That's increasing the spread. Now, they talked about the housing opportunities for these people, and they said that, well, we're not actually going to be providing houses for them. They can go visit with their relatives and stay with them. First of all, that's a very unreliable way of housing them. But second of all, if they really are, well, for most of these prisoners, their relatives are going to be either their parents or maybe their siblings, maybe their cousins. Either way, they're going to be interacting with people who are trying to stay safe in their home, but instead have to deal with prisoners coming from the outside world after interacting with hundreds of other prisoners. You see, what's bad about this is that if prisons are really as contagious and dangerous as the affirmative team says, then we shouldn't be letting all these people out into the world to infect everyone else if prisons are as dangerous and as contagious as the affirmative team says, especially when we don't know who's sick and who's not because of a lack of testing. They talked about decreased spread. First response is no proven harm. They haven't proven a harm. They haven't proven that people will die. And that's a problem because their entire advantage is that we're saving lives. But they haven't proven that because we don't know of a single case of anyone dying. My second response here is no proven decrease. We haven't seen the affirmative team prove an actual decrease in the spread because what we see is that while they could be spreading it around within the prison, well, when we let them out, they'll also be spreading it around to the entire population around them. And that could result in even more people getting sick than would have if everyone just stayed in the prisons. So impact here is outweighed. If we can't prove the harm and the affirmative team can't prove the advantage, then we see no reason to pass their plan, and the disadvantages obviously outweigh it. They talked about a precedence of nonviolence. My response to this is nonviolence does not equal no harm. That's nonviolence does not equal no harm. Now, earlier, I was asking for the evidence on which ones are nonviolent crimes, and it turns out, in their case, the violent crimes are murder, rape, sexual assault, and assault. However, all the other crimes apparently are nonviolent. Things like extortion, fraud, robbery, larceny, burglary, banking and insurance counterfeit, embezzlement, kidnapping, aggravated assault, and sex offenses. So lots of things are considered quote-unquote non-violent, but the affirmative team likes to act like non-violent is equal to no harm. But we see that's not the case. What we see at the end of the day is we can't be sacrificing the good of the public, the law-abiding public, to maybe help some law-breaking prisoners. Thanks.
The affirmative team will be taking prep time. We have 5 minutes remaining. No further prep time needed. We have 3 minutes and 2 seconds remaining. I'm going to set my timer for 5 minutes. Assuming everyone's ready, then I'll begin. We have to release the nonviolent prisoners in order to allow both the prisoners and entire communities to stay safe. Today, I'm going to be going down the flow of the last 2 speeches and responding to the arguments made there. And I have a lot to get into, so let's jump right in. So first, I'd like to respond to their argument of antidote. They said that we only gave one example of a prison in New York that had been infected. And this was untrue. So basically, I'm going to talk about the evidence of the severity of the problem that's been brought up in this round. So first of all, we have 2 examples of specific prisons. The evidence we brought up in harm 2, which was of a prison in New York City. And then the second piece of evidence was the evidence my partner brought up about a prison in Louisiana. And then we have 3 pieces of evidence that come from experts specifically. Now, this first one came from the CDC, and it was about the contagiousness of the virus. The second one came from a news outlet, and it was about the underlying conditions that prisoners have. And the third one came from a Yale professor of epidemiology and public health who was discussing how prisons are the perfect storm for COVID-19. So we have provided you 2 specific examples of prisons and 3 experts who all can say this is a problem. Next, I'm going to address the argument that this is not unique. It's not unique. They said that our argument was not unique and there was always a risk of disease in prisons, but the coronavirus is different. It's more contagious. The reason that evidence wasn't there wasn't to say that we should just always have prisoners being released because there's disease there. It was just to show you the scope of the situation, how this is a problem because they have underlying conditions because of the prison and it will only get worse. Next, I'm going to address their significance argument that we have no way to know who's sick, no way, because we can't test people. So just to clarify, we're going to be releasing people who are free of symptoms and haven't been in close contact with anyone who has COVID. Basically, because we can't tests are so hard to find, we are going to be doing the best to our ability to figure out who has it and letting the people who don't have it be released. Next, I'm going to address the argument of housing. And so they said that we would have to rehouse 50% of prisoners. So basically, probation officers are going to make sure that people aren't living on the streets. That's part of their job. They're going to make sure there's some sort of housing provided. The government isn't going to provide the housing, but they'll make sure it's there. Then I'm going to respond to the disadvantage that it would have increased spread because they won't social distance. First of all, they have a logical incentive to social distance. Who would want to get COVID, obviously, right? No one wants to get sick. And that is why so many people are social distancing in this problem. So logically, even these prisoners would do that because they wouldn't want to be sick. And my second response is that probation officers will enforce it. So basically, in specific areas where they have requirements for social distancing, those are part of the law. So a probation officer will make sure that is enforced and that those people don't violate those. They said we couldn't prove at least one death. But as I mentioned earlier in my speech, we have provided numerous examples of the gravity of this situation. We can see that it's a crisis waiting to happen. There's a huge problem here, and we need to get these people out before it's too late. Just because we don't have specific numbers doesn't mean we shouldn't do anything. We won't increase the spread, again, because the officers will ensure. And even if they are housed with family members, they will have greater opportunity to social distance. Because in prison, they're in contact with hundreds of people, but within a housing situation, even if were living with a couple of different people, they would still only be probably seeing about 10 people, whereas in prison, they're seeing hundreds a day. So that it does help us to increase social distancing. Finally, I would like to clarify nonviolent crime. Now, it's kind of hard to provide you with a definition or a lot of information about nonviolent crime because the government doesn't specifically define it. It defines violent crime, and then it tells us what crimes, and then we have a list of all the crimes. So the negative team seems to have misunderstood this evidence. So what they were reading for wasn't a list of nonviolent crimes. It was just a list of all crimes. So kidnapping is a violent crime. Homicide is a violent crime. A lot of these are violent crimes. But the thing is, this was just all crimes with numbers, and our other piece of evidence after that in the 1SC provided which ones were violent, so you could see which ones are non-violent. Thank you, and I strongly urge an affirmative ballot.
Starting prep time. No further prep time. All right, I'm going to assume everyone's ready and get started. I think what's going to be most important for this last negative speech is that I lay out what happens whenever you vote affirmative. And then I'm going to lay out what happens whenever you vote negative, and then show you how voting negative is an exponentially better world than affirmative's alternative. The first argument she talked about was how they have 2 examples and 3 experts. My response is no impact. Yes, they do have experts that say COVID-19 is dangerous, or not even, a lot of it wasn't even specific to COVID-19. A lot of it was specific to other diseases like tuberculosis and pre-existing health conditions. But yes, they do have 3 experts that say COVID-19 is dangerous, or other diseases are dangerous, or other prisoners have other diseases, which is something that they've been harping on. That doesn't mean that COVID-19 is so much more dangerous in prisons that it requires government action. If we used the affirmative team's logic and said, well, there's obviously a problem, therefore government action, that doesn't logically connect. If we did that every time that there was a problem, then our political system would be a mess. Luckily, we don't follow affirmative team's logic, and usually we let other governments work this out. But the other reason there's no impact here is because they still haven't proven that it's a large problem. Whenever the U.S. first was introduced to coronavirus, whenever our first contagious person came, no one saw it as a big deal. And just because another person came in, we still didn't see it as a big deal. In fact, it wasn't really a big deal until about 100 people got it, and then the CDC decided that it was a pandemic. Just because they have 2 examples of the prisons being infected, that doesn't mean that it's a big deal. We'd have to see a large amount of these prisons actually getting infected, again, to require government action. Next, they talked about, in response to non-unique, they basically said, well, this evidence wasn't supposed to prove that COVID-19 is dangerous, just that there are people with pre-existing health conditions. Tag of this argument was breeding grounds for infections, so I just assumed that they were saying that COVID-19 was going to breed in prisons. But if they're not saying that, then what's the harm? If they're not saying that the harm is that there's a breeding ground, then there is no harm. But again, if they are saying that, then we see my response, which you can write down as still non-unique. Again, this evidence was only talking about other diseases. And I wasn't saying that that means that COVID-19 isn't a problem. What I was saying is that that means that under their own logic, we would respond to these other diseases the same, because it equates them to, or the affirmative team equates these diseases to COVID-19. Let's talk about their other arguments. They said that prisoners would have a logical incentive to not to social distance. And my response is many examples. Actually, plenty of people don't social distance. In fact, a lot of people still go on public. A lot of people are still working. A lot of people still do things, still go to the beach. They do a lot of things that aren't social distancing because they don't see it as a threat. Obviously, not everyone's going to have this logical incentive. And so affirmative can't just say that all prisoners will social distance perfectly, because that doesn't make any sense. Next, they talked about how they had a probation officer, therefore they are not going to go out in public and infect people. My response is can go in public. I actually established this in the very first cross-ex. I said, can the prisoners still go to public? And they said yes, as long as the parole officer lets them. And that means that these people could very well be infected, and going out into public infects other people. That's how COVID-19 works, and that's the danger of the affirmative team's plan. So let's talk about the voting issue that talks about what happens when we vote affirmative. This voting issue you can write down is not plausible. Their case isn't plausible in any sense of the word. And what I mean by this is that it's not a case that can viably be passed by Congress. Subpoint A is can't, no infection. They're saying, well, anybody who's not infected gets to get let go. Anyone who's infected, well, they're obviously dangerous, so we're going to keep them still in the prison. But that's not a good way to decide this, because as we already talked about, we can't know the infection. So we could very well be letting people who have the disease out to public contact. Second reason it's not plausible is because it doesn't account for the problems. This is subpoint B, the problems. There are so many problems that they haven't accounted for, like housing. They haven't talked about where they're going to put these people. They said, well, they could stay with relatives. Do these people even have relatives? They haven't proven that these people have a place to stay. The last problem is that it's a danger to society. By passing this plan, you put a danger on society, which is why I ask that you don't pass it. Thanks.
The affirmative team will be taking a remaining 3 minutes and 2 seconds of prep time starting now. No further prep time needed. I'm setting my timer for 5 minutes. And assuming everyone's ready, I'll begin. Whenever we look at a policy, we need to look at its purpose. So today I'll be doing that by clarifying how Bela and I believe that everyone has a right to protect their own life. This is something I believe the status quo and the negative position does not achieve. So today I'll be addressing some negative concerns that my opponent brought up, and then clarifying with a couple of voting issues why it would be a better world to pass the affirmative plan. I'd like to begin with my opponent's first argument of no impact. He claimed that our two pieces of evidence citing specific prisons that were either on the verge of or continuing in an outbreak of coronavirus, and three pieces of evidence from medical experts had no impact on the round. And I completely disagree, so I have a couple of responses. The first one you can write down as show significance. Show significance. We're proving the significance of the problem and how close we are to an overblown crisis by these pieces of evidence. We're not simply bringing them up for a non-existent issue. This issue matters, and it matters because it's the basis of this entire round. It has been proven with affirmative evidence. This leads me to my second response. Crisis exacerbated in prisons. Crisis exacerbated in prisons. Now, this is a logical step too. Think about a prison. Prisoners are in close quarters with cells. They often don't have a sink or a proper bathroom to wash their hands or practice hygiene. They have to shower in close quarters with other people. There's no ability to social distance in prisons. Next, I'd like to address his argument that some people don't follow social distancing guidelines, and somehow this applies to people on probation with an officer overseeing them. I have one main response. Officers enforce social distancing. Officers enforce social distancing. See, these people on probation will have to abide by local regulations, and probation officers and local law enforcement will be willing to enforce this. Now, Caleb mentioned that we somehow disagreed that we can't go in public, but I would disagree that we ever held this position. We agree that people on probation can go out in public, but only for essential services. They must social distance just like everyone else to keep their community safe. Next, I'd like to address his point that we can't know infections. I have two main responses here. The first one you can write down as we should act before people die. Should act before people die. To put it simply, we can't wait for hundreds, maybe even thousands of people to die, then be reported to the federal government, for the federal government to finally turn around and say, gee, we should do something about this. That's not the way we should work. So this leads me to my second response. Preventative. We're preventing coronavirus spreading like wildfire. As to housing, my response is officers oversee. Officers oversee. Again, it's normal probation protocol to not ensure housing, but the probation officers will oversee this. Finally, I'd like to bring up a couple of voting issues. My first one, you can tag as safe. Safe. Now, this is in response to, I believe, Levi's argument about being a danger to society. My first subpoint you can write down as misunderstood nonviolent. Misunderstood nonviolent. Now, for total clarification, in the chart that we read in the 1AC, homicide, aggravated assaults, and kidnapping, national security, robbery, sex offenses, weapons, explosives, and arson are all violent, and I believe the negative has misunderstood this. We are looking at people who have a history of complete nonviolence, and this leads me to my second subpoint. Proven with evidence. Proven with evidence. We've proven that probation is actually safer than people being incarcerated. This leads me to my final subpoint. Subpoint C. Past precedents. These people have a logical past precedence of being nonviolent. Next, I'd like to bring up a second voting issue. Preserving health. Preserving health. See, people on probation will have to social distance. They'll have officers overseeing them. They won't be a threat to public safety at all. And they'll be able to social distance because this is what the round boils down to. Everyone has a right to protect their own life. And by passing the affirmative plan, we make that possible for nonviolent federal prisoners. For that reason, I would strongly urge an affirmative ballot.
Thank you for jumping.
Nice job, you
and
guys.
Good job, guys.
Thank you for judging.
Thank you for judging. Great job, Negative.
All right, I'm going to stop the recording.